Hello and welcome back to GP Video Podcast by Nadia. So we are continuing with the screening of colorectal cancer, and we have already spoken about the average risk, and then we are now going to talk about moderate risk category and high risk category. Now, I have explained this, but I'm again going to tell you about it. Bowel cancer is the second biggest cause of cancer death in Australia, while it is the fourth most commonly diagnosed cancer in Australia. And it is estimated that 1 in 20 people will be diagnosed by the age they are 85. Otherwise, the average age at diagnosis is 69 years old, but these days it's been diagnosed in early 30s as well. So it is on rise, being diagnosed, and it is very commonly present in the community. So we need to know really what is the screening program for colon cancer. Now, I again would like to repeat this: mouth, esophagus, pharynx, esophagus in the chest, stomach, small intestine, large intestine, rectum, anus out. So any tumor arising in the large intestine or the rectum is called colorectal cancer, depending on which part of it is arising in. Okay, so and it arises from the inner lining of the colon, and it is usually preceded by tubular adenomas, and if they go undetected, they can become invasive or malignant in nature. So if they are detected on time, then they can be removed, and the chances of getting them cancerous is gone. And then what happens is every 3 to 5 years surveillance is done, colonoscopy is done, and if there are more adenomas, then they are removed, and they don't get invasive or they don't become malignant. Now, there are two kinds of individuals: one who are symptomatic, who what are the symptoms? Change in bowel habit, including diarrhea, constipation, or alternative, or the feeling of incomplete emptying. A change in the appearance or consistency of bowel movements, such as thin bowel stools, blood in the stools, abdominal pain, bloating, cramping, anal or rectal pain, a lump in the anus or rectum, weight loss, unexplained fatigue, tiredness and or anemia, so pale complexion, weakness and breathlessness. Sometimes blood in the urine or passing urine frequently or during the night, change in urine color, dark, rusty or brown. So apart from them could it being a sign of like urinary bladder cancer or urinary stones or other disorders of kidneys, ureters, urinary bladder and prostate, they can be a sign of bowel cancer as well. So again, all these symptoms can be present in other diseases as well. But if, for example, change in bowel habits, including diarrhea, constipation, or the feeling of incomplete emptying, could be present in irritable bowel syndrome. But in irritable bowel syndrome, you don't have blood in the stools. But blood in the stools could be a part of irritable bowel disease, like ulcerative colitis or Crohn's disease. But if these symptoms are present, we need to go and see our GP, and GP will do a few tests and will exclude colon cancer. So the tests would be blood tests, but the most important screening test, fecal occult blood test. So for example, if you're already complaining of blood in the stool, so fecal occult blood test would not be of much importance. Then the GP will go with the blood test, CT scan and or colonoscopy. So this is about symptomatic individuals. Symptomatic individuals need to be investigated thoroughly as according to their symptoms, and according to the more the symptoms you are, the more indicative it is that it could be bowel cancer, or bowel cancer needs to be excluded. The lesser the symptoms there are, then GP will decide accordingly. But you need to consult your GP if you have any one of these symptoms, okay? And then GP can decide what to do next. But if you are asymptomatic, then what? Colon cancer can be truly, absolutely asymptomatic, and you could have no family history, but you could still get it. So what is the screening program? So we spoke about it earlier today, about three risk categories: average risk, moderate risk, and high risk. Average risk people are those people who are asymptomatic. For screening, you need to be asymptomatic. So asymptomatic with no family history, or one first degree relative or second degree relative if their age at diagnosis was more than 55 years. So either you have no family history, you have no symptoms, or you have no symptoms for sure, but one first degree relative or second degree relative with colorectal cancer diagnosed at the age of more than 55 years. Then what's the screening program? Screening program is every 2 years from 45 years to 74 years, a fecal occult blood test, which is a stool test, which is a screening test. And then after 74 years, we don't need it anymore. And no colonoscopy is needed. Okay. So previously the age was 50 years to 74 years, but now it has been lowered down to 45 years to 74 years. Okay. So 2 yearly fecal occult blood test. No colonoscopy is needed until and unless you develop any symptoms. And then after 74 years, not needed. Now we come on to moderate risk. Moderate risk are the people who are asymptomatic for sure. That's the criteria for being screened, with one first degree relative or second degree relative with the colorectal cancer being diagnosed at less than 55 years. Then you become moderate risk. So what is the screening program for that? Again, so now fecal occult blood test from 40 to 49 years, every 2 years. Then colonoscopy every 5 years from 50 to 74 years, or 10 years earlier than the youngest relative, whichever is earliest. Okay, I'll explain that to you. So you are at moderate risk if you have one first degree relative or one second degree relative, or, okay, with colorectal cancer diagnosed at less than age of 55 years. Then the screening program is again fecal occult blood test, but starting at the age of 40 years till 49 years, every 2 years. And how will we do colonoscopy? So let's say your relative was diagnosed at 50 years. So we'll start the colonoscopy from 40 years. So 10 years younger. Or if the, so 10 years earlier than so whatever age he was diagnosed at, we'll start the colonoscopies from there. So we'll do both the fecal occult blood test and the colonoscopy. So fecal occult blood test from 40 years to 49 years every 2 years, and colonoscopy every 5 years at the 10 years earlier than the youngest relative, whichever is earliest, and that will continue till 74 years. So let's say your relative was diagnosed at 50 years. We'll start both fecal occult blood tests and colonoscopies at 40 years. We'll do colonoscopy every 5 years till 74 years, and we'll do fecal occult blood test every 2 years till 49 years. If you are getting colonoscopy, they might just skip doing fecal occult blood test altogether and just do colonoscopy, but that depends on the GP and the specialist. So now we know what is average risk, what is moderate risk. Tomorrow we will talk about high risk people. Have a great day.